If you're a man over 40, this is something you need to hear. Erectile dysfunction is affecting millions of men right now, quietly, alone, and mostly in silence, because nobody talks about it. Not with their mates, not even with their doctor. But here's the part that matters. For many men, this isn't just about performance. It can be one of the earliest warning signs of underlying health issues. Sometimes, before anything else shows up, which means this isn't something to ignore. And you are not alone in this. In fact, more than half of men between 40 and 70 experience this to some degree. So if this is happening to you, it's not weakness. It's not failure. It's something that can be understood. And in many cases, improved. Let's break it down simply. Erectile dysfunction, ED. Call it what you want. But here is what you need to understand. It is not a character flaw. It is not weakness. And it is not something you simply have to accept. It is a medical condition. One of the most common medical conditions, affecting men over 40 worldwide. Research suggests that more than half of men between the ages of 40 and 70 experience erectile dysfunction to some degree. Half. That means if you are sitting with this right now, you are far from alone. So why does it happen? The honest answer is, it is rarely just one thing. For most men, ED is the result of a combination of physical, psychological, and lifestyle factors. On the physical side, conditions like cardiovascular disease, high blood pressure, diabetes, high cholesterol, and obesity are all strongly linked to ED. And here is something that many men don't realize. Erectile dysfunction can sometimes be one of the earliest warning signs of cardiovascular disease. Before chest pain, before breathlessness, before any other symptom, which means that going to see your doctor about ED could actually save your life. On the psychological side, stress, anxiety, depression, relationship difficulties, and the pressure of performance itself can all contribute significantly. And then there are lifestyle factors. Smoking, alcohol, lack of physical activity, poor sleep. All of these have a measurable impact. Here is what happens to most men. They notice something has changed. They say nothing. They hope it will resolve on its own. And when it doesn't, the anxiety about it makes it worse. And the worse it gets, the more they avoid. Avoid their partner. Avoid intimacy. Avoid the conversation. Avoid the doctor. Until something that was very treatable has become wrapped in shame, isolation, and years of silence. This is the part nobody talks about. ED does not just affect the bedroom. It affects confidence, identity, relationships, mental health, and overall quality of life. So what can you do? Step 1, and I cannot say this clearly enough, speak to your doctor. I understand that feels uncomfortable, but your GP has this conversation regularly. It is a medical appointment like any other. And what comes from that conversation could genuinely change things for you. Your doctor will want to understand whether there are underlying physical causes. They may check your blood pressure, your cholesterol, your blood sugar, your testosterone levels, because treating the underlying cause often resolves or significantly improves ED. In terms of treatment options, there are several well-established approaches. Medication, and yes, it works for many men. Lifestyle changes, which have a significant and often underestimated impact. Psychological support, particularly when anxiety or depression is a factor. Relationship counseling, which can be transformative when both partners are involved. And in some cases, medical devices or other clinical options. The point is, there is no single answer. But there are answers, and you deserve access to them. I also want to speak directly to the partners watching this, because many of you will have found this video not for yourself, but for someone you love. If your partner is dealing with ED, the most powerful thing you can offer is not a solution. It is safety. Safety to talk. Safety to be vulnerable. Safety to seek help without fear of judgment. Men do not ask for help easily. That is not stubbornness. That is a lifetime of being told that they should manage alone. Your patience, your understanding, and your willingness to face this together may be the thing that finally opens the door. Erectile dysfunction is common. It is treatable, and it is nothing to be ashamed of. If today's video gave you something, even just the knowledge that you are not alone, then it has done its job. Please give this video a thumbs up. It genuinely helps more people find this channel. People who may really need to hear this today. And if you feel comfortable, drop a comment below. Just type "The conversation starts here," because that is exactly what this is. If you are new here, welcome. This is Retirement Central. Calm, clear, honest. Every week, for the over 40s, for you. Hit subscribe and press the notification bell so you never miss a video. Take care of yourself, and I'll see you in the next one.